That's fascinating actually, because I think it is different for women. I think they're judged the minute they walk through the door, and I think particularly when if you've worked as an interim, you are judged and judged and judged again, and usually the first questions are, what's this person coming to do and how much are we paying them? They're usually the first questions. So not what skills do they bring, or what are they here to change. It's usually, it can be quite seen as quite negative.
We all feel a bit of imposter syndrome. It tends to be quite a female phenomenon. Maybe I don't merit being in this position.
I always felt, well, I'm not good enough, I'm not shiny enough, I can't do this, sort of middle ground, I'm either here or there. And I think, and that's wrong.
So, I think we need to do some work on ourselves a little bit about that.
I think when I've seen great boards, it's because you do have differences of opinion. That doesn't mean you don't have cabinet responsibility.
The way we're trained sometimes can have an influence, and obviously there's concerns about not just being at work, but also often the main person at home, often the person trying to run a lot of things. And I do appreciate some people get shot down for saying this, but sometimes people make a decision not to want to go much further. There's also a lot, and I think this applies to people from BME backgrounds as well, the taps on the shoulder that come along to this networking event will often not be extended in the same way, or people won't be able to go along to them because they've got family commitments. So some of that informal, understated, not written down stuff can be a factor, can be a barrier.
I think one of the challenges I'd say I've had is how I look. So I speak to people on the phone, I have a very English accent, I've been educated in this country, and often when I go to meetings and haven't met people before, there's a little element of surprise, and that always surprises me, but I think it's an important thing to be aware of, and I think it can also be a positive thing because people tend to remember you, people remember what you say, and that's something that I think we need to appreciate. Being aware of the level of diversity, being aware of diversity at your meetings, within your clinical settings, within your workforce, just being aware would be a first really, really good step.
I do remember when I was a director in the NHS, fairly recently appointed, going into one predominantly male meeting, and someone saying to me, I'll have tea with 2 sugars please. So, which was, and I said, oh, I think I'll have the same.
I think for women who want to get into positions of leadership, I think having thinking about where you want to go, how you're going to get there, looking at who's around you.
I think my advice would be resilient, be tough on yourself about saying there will be 3 knockbacks, 2 failures and 1 success, and that's okay, and I can live with that.
Don't be so hard on yourself. Give yourself time to really grow into a role.
I think build your own inner strength and your own inner confidence, and don't be frightened to make sure you get access to your CEO, access to your chair.
Ask for help.
And really push forward with the initiatives that you want to do. Because I think if you don't do it, nobody's going to come along and make that happen.
Keeping yourself well trained, having access to new ideas, new inspiration, I think that making yourself feel confident.
Build your network of support. Build it within your organisation, outside your organisation and in your personal life. I think that's what's really important, because as a manager and as a therapist you're giving yourself, you're actually drawing on your personality. You need to have good knowledge and expertise to do the technical job, but it's about how much you're prepared to challenge other people, hold people to account, say no in difficult situations.
I think you do have to have some courage in your convictions. I think it's important. And if you don't, I think it's not just that you pay a personal price. I think your organisation pays a price as well. And I don't think you need to be reactionary or shroud waving, but I do think you need to be strong and ballsy and those things, because I think it can be important. You can, and as I've got older, I'm not as quite perhaps as radical as I was before, but actually, if you lose that, you've lost yourself.
And I think, you know, one of the things, we've all got to look after our own sort of physical and mental health. And so for me, making time to swim, to walk, to spend time with friends, to eat well and to sleep well, if those things aren't right, then I won't be able to cope with some of those pressures at work. And they sound really mundane, but I'm very clear that I must have time. So things like, you know, skipping lunch, no. There's no point skipping lunch. You won't behave as well in the afternoon as you did in the morning. Working late's fine, but you've got to eat early enough to go to bed on time. You know, you've got to actually set up your life so you can take on these responsibilities, and you've got to make sure that those around you accept that you will have to give a lot of yourself in your senior leadership role.
I think if you can then empower your staff to say, you know, these things are a given. We've got to sort the money, we've got to sort performance. It's anchored around safety, it's anchored around patients, and we're better than this. And our patients deserve better when you can galvanise people. And I think generally you can get there. But I think, you know, being a wee bit ballsy is a good thing. Yeah, not everybody would agree with me, but you know, there we go. Strong women.
Yeah.